Hello, welcome to the Sans Pareil Paediatric Clinic channel. This is Dr. Shamik Ghosh, a Senior Consultant Pediatrician, coming to you with certain solutions for the coming summer. The summer beckons the start of diarrheal illnesses, vomiting, and upset stomachs. Now, we all know that the human intestine is a super sensitive structure. As long as it is receiving nutrients, it happily absorbs them. The moment there is something that is non-nutritious, it needs to expel. So this expelling is a protective reflex in the form of vomiting or in the form of diarrhea. And the processes will not go on forever. They shall stop the moment the last particle is expelled. What happens in between is that along with the expulsion of the germs or the foreign particles, a lot of salt and water is also being lost from the human body. A time was there when this loss could only be replenished by the intravenous route. But at the last 40 to 50 years, in an epoch-making discovery of this century, Dr. Dilip Mahalanobis, he discovered the ORS, or the oral rehydration solution. And this has now enabled us to start rehydrating the individual almost as soon as the problem begins. So the moment your child has passed stools more than 3 times, has vomited more than 3 times, or has had a high rise of temperature, please start rehydrating your child. This needs to be done with a WHO certified oral rehydration solution. Caution has to be exercised because most of the good ORS solutions are not very palatable. To working on this feedback, a lot of companies have introduced tasty ORS, sugar filled ORS, which are actually very concentrated solutions, and instead of rehydrating the individual, can actually dehydrate the individual even further, because these concentrated solutions draw out fluids from the human body. So please be careful to use a properly constituted WHO certified ORS. ORS can never be given in bulk quantities. The bulk quantities of a salt solution are not palatable to anyone. They can induce vomiting. Sometimes they can induce further diarrhea. So what you need to be doing is giving very small quantities at frequent intervals. For example, a 10-kilo child needs about 1 liter of ORS in 24 hours. So after reconstitution, if I were to give just 2 teaspoons every 10 minutes, the child would be getting around 60 ml in an hour. Children remain awake for 16 hours, sleep for about 8 hours. So in these 16 hours, if the child is getting 16 multiplied by 60, it works out to about 1 liter of ORS in 24 hours. So my dear parents, please give ORS in very small quantities, giving sufficient gaps of 5 to 10 minutes between each administration. Keep a watch on the urine output. If that is more than 4 times in 24 hours, you are reasonably reassured your child will not go into significant dehydration. Most of the times, what enters the body leaves the body on its own. So, most diarrheas would be self limiting, and just keeping the child well hydrated solves the problem. If you have additional symptoms like a very high fever, blood-stained stools, or very prolonged loose stools, you definitely need to consult your doctor. But believe me, in many instances, just giving proper oral rehydration therapy solves many of your summer issues. We are happy here at Sans Pareil Paediatric Clinic to receive your comments and also answer any further queries. Thank you so much for your patient listening.